So hello, good evening everyone. I am Dr. Omkar Sonone and today we'll start our discussion with vascular surgery. Like all of us are quite aware that we had a session but there were some technical glitches. That's the reason why I thought to conduct it in a video. So it would be better that we could have it in a bunch, okay, at one place. So let's discuss some important points about vascular surgery. I'll not take much time. Before I start, I want to clarify one yesterday's doubt that most of the people had. Like in cases of tension pneumothorax, when a patient presents to us in emergency, then what should be the first line management? As we had discussed already, the first line management would be needle insertion. Wide bore needle is inserted usually, okay? It is inserted in which intercostal space? So it is the second intercostal space on the mid clavicular line. According to the recent ATLS guidelines of 2018, guys, they have definitely given that the needle insertion should be done usually in the safety triangle, that is in the fifth intercostal space of the mid axillary line. But after consulting of many faculties from medicine as well as surgery, we have come to a conclusion, guys. So please remember, if ATLS is mentioned in the question, then you need to mark it as fifth intercostal space, mid axillary line. Otherwise, usually the most accessible part in adults for tension pneumothorax is usually the second intercostal space, mid clavicular line. In emergency, usually we would require a more easier option, okay, and that is the reason why we will mark it. I hope this was clear with everybody. No issues with that now. Moving further, talking about vascular surgery, guys. So talking about arterial as well as venous disorders, okay? So we need to just discuss some important points from which questions had come earlier, okay? So if we start our discussion with arterial disorders, first of all, if we talk about gradual arterial obstruction, okay? So gradual means it is slower in onset, okay? Over a period of time it will develop, okay? So gradual arterial obstruction, the most common cause is atherosclerosis. So most common cause of gradual arterial obstruction is atherosclerosis, followed by Burgess disease, I hope this is fine. So now when a patient presents to you with gradual arterial obstruction, the first change or the first complaint that will have is intermittent claudication. And what do we mean by intermittent claudication? The patient will complain of pain as soon as he starts walking. Okay, so on walking a certain distance, the patient will complain of pain, and the distance that he walks is known as the claudication distance. I hope this is fine. So the first change we'll see in gradual arterial obstruction would be intermittent claudication, that is pain on walking. Okay, more commonly it is developed in lower limbs, therefore it is referred to as pain in lower limbs or pain in the calf. Okay, but it can also be seen in upper limbs. Okay, usually it is seen in writers. Whenever they start writing, they would experience pain in their upper limbs if there is some arterial obstruction of the upper limbs. Okay, and this is known as writer's spasm. Okay, it is known as writer's spasm. So it is nothing but intermittent claudication of the upper limbs. Okay, but more commonly intermittent claudication, or for that matter gradual arterial obstruction, develops more commonly in the lower limbs. I hope this is clear. Right, so it can develop in any of the arteries, just like the coronary arteries also, which can land up the patient in angina or myocardial infarction. Right, am I clear with this? So great. So if we move forward, after intermittent claudication, now the patient will start complaining of pain even at rest. Okay, so he'll complain, Dr. Saab, whenever I'm sitting also I experience pain. This is known as rest pain, and it is due to ischemia of the nerves. Okay, therefore rest pain is also known as cry of dying nerves. Okay, then further when the patient will progress with the arterial obstruction, then the patient will experience features like coldness, numbness and paresthesias. Therefore in the lower limbs or in the upper limbs, wherever there is the arterial obstruction, the patient will feel that the extremities are cold. Okay, they are numb, he cannot feel any sensation, and he'll experience paresthesias. Okay, important. Then it will further progress usually to pre-gangrene when color changes start to develop over the skin of the affected part. Okay, these color changes are due to ischemia, so there would be pallor, or if there is cyanosis, then there would be bluish discoloration. Right, so this color changes will start to occur. After pre-gangrene, now it can further progress to critical limb ischemia. And by critical limb ischemia we mean after this the leg or the hand, whatever it is, the affected part will certainly undergo gangrene. Okay, this is known as critical limb ischemia, and finally the patient will land up in gangrene. Gangrene is what? Gangrene is necrosis of the affected part, okay, along with putrefaction. I hope this is fine. Moving further, then if we talk about the investigation of choice, usually investigation of choice for arterial or venous disorders, it is usually a colored Doppler. Okay, for assessment of any of the vessels of the body, the investigation of choice is a color Doppler. Why color Doppler? It is just an ultrasound, we can say, of the vessels. Okay, why color Doppler is preferred over angiography then? So please remember, as color Doppler is a non-invasive technique, therefore it is preferred over angiography. Okay, as we all know, color Doppler is non-invasive, therefore it is the investigation of choice. Whereas on the other hand, angiography, it is invasive technique, but definitely it has high yielding results. It has definitely high yielding results, and therefore angiography is considered as the best or the gold standard method. For assessment of vessels, the best or the gold standard method is angiography, but investigation of choice, if they ask, then it would be color Doppler. I have made myself clear. Moving further, if we talk about angiography, that means study of vessels, right? So angiography, it is usually performed via the femoral artery. Which artery? Femoral artery. And the technique with which it is performed, it is known as the Seldinger technique. And the needle which is used is known as the Seldinger needle. So important 3 points about angiography. First, it is the best or the gold standard method for assessment of any of the vessels of body. First. Second, it is performed via the femoral artery. And third, the technique with which it is performed is known as the Seldinger technique, and the needle is known as the Seldinger needle. Right? Very good. Then if we talk about the treatment of gradual arterial obstruction now, the first thing would be lifestyle modifications. Why? Because the most common cause was atherosclerosis. It is usually seen in morbidly obese patients, right? Or patients with some comorbidities. Therefore, lifestyle modification should be the first choice. Like the patient should be asked for a brisk walk. He should be asked to reduce the weight. He should be asked to quit smoking. Okay. So all of these would be lifestyle modifications. Then definitely we can use some drugs, and these drugs can be vasodilators. Vasodilators like pentoxifylline or silastazole are used usually. Okay, these drugs are vasodilators like pentoxifylline or silastazole are generally used in these cases. Okay, question has been asked on pentoxifylline, so it is important to be remembered. Okay, sorry. Then definitely apart from drugs, apart from the medical management, we can use surgical management. And the surgical management which is commonly used is known as PTA. Okay, that is known as percutaneous transluminal angioplasty. Okay, percutaneous transluminal angioplasty. Okay, that means reconstruction of your vessels. Whichever vessel is affected, it is to be reconstructed. That is known as angioplasty. Right? So percutaneous transluminal angioplasty or PTA. PTCA would be when it is the coronary vessels. Okay, so whenever we actually try to repair the coronary vessels, it is known as PTCA, percutaneous transluminal coronary angioplasty. I hope it is fine. So now this PTA angioplasty can be either a balloon angioplasty with which we can dilate the vessel, or it can be a stent angioplasty. That means we will introduce a stent. A metallic stent is usually preferred. A metallic stent vagara is introduced into the vessel, right, to prevent further progression of atherosclerosis. Right? I hope this is fine. Then we can also perform a bypass graft surgery. Okay, so bypass graft surgery is generally performed, and for that we can use an autologous graft. Means some vessel from our body itself, that would be known as an autologous graft, or we can use a synthetic graft. Okay, a vessel which is prepared by some other material outside, right? So the best autologous graft, if they ask, then the answer should be GSV, that is great saphenous vein. Okay, so the best autologous graft would be the great saphenous vein present in our lower limbs, right? Or we can use some arteries like the lima or rima, that is left or right internal mammary artery, left or right internal mammary artery. That is the best autologous grafts. Then if we talk about the best synthetic graft, okay, that is Dacron. Best synthetic graft is made up of Dacron. Best synthetic graft of Dacron. Okay. Then after bypass grafting surgery, we can also have an option of lumbar sympathectomy. Lumbar sympathectomy is actually removal or destruction of the L1 to L4 ganglia. Okay, we try to remove the L1 to L4 lumbar ganglia, due to which there would be increased blood flow to the lower limbs. Okay. So restoration of blood flow would be seen in the lower limbs after lumbar sympathectomy. I hope this is fine. So these surgeries can be performed, either a PTA or a bypass grafting surgery or a lumbar sympathectomy. I hope this is fine. Moving further now. Okay, But before moving further, you need to remember this instrument. What is this instrument? This is a Fogarty's vascular catheter. What is it? It is a Fogarty's vascular catheter. And this Fogarty's catheter is usually used in cases of PTA, percutaneous transluminal angioplasty. So whenever we need to perform a PTA, we can use this Fogarty's vascular catheter. Image is important. Okay, it has a balloon at its one end. You need to remember this. Okay, a balloon is present at its one end. Then if we talk about the second most common cause of gradual arterial obstruction, and that was Burgess disease, right? Burgess disease is also known as thromboangiitis obliterans. Okay, thromboangiitis obliterans. Everything is in the name. Thromboangiitis, that means inflammation of your vessels. Obliterans means there would be blockage or obstruction of these vessels, right? Thromboangiitis obliterans is another name for Burgess disease. It usually involves which kind of vessels? It usually involves the medium or small sized vessels. Medium or small sized vessels. Then the criteria for Burgess disease is known as the Olins criteria. So which is the criteria for Burgess disease? Olins criteria. Criteria for Burgess disease is known as Olins criteria. And according to Olins criteria, these three things are important. There are other things too, but these three are important. That first thing, there should be a history of tobacco use. That means the patient should be either using tobacco or he should be a smoker. Important. Second feature, that the person should be a young male, because Burgess disease is commonly seen in young males less than 45 years of age. Third feature is there should be signs and symptoms of distal ischemia. Okay, whenever there is obstruction or there would be ischemia, and due to ischemia there would be pulselessness, okay, there would be coldness, numbness. So these are features of distal ischemia. Those should be present. So the Olins criteria is used for Burgess disease, and the features are: first is history of tobacco use or smoking. Second, it usually affects young males less than 45 years of age. Third, distal ischemic signs and symptoms should be present. Then if we talk about angiography, okay, if we talk about angiography over here, then on angiography we get a characteristic appearance in Burgess disease that is known as the corkscrew appearance. This is known as the corkscrew appearance. Here you can see in this vessel, okay, the smaller vessels. This is the corkscrew appearance. Okay, this was about Burgess disease, you need to remember. So it will usually present a 30-year-old chronic smoker male presents with complaints of intermittent claudication. Okay, on examination the pulse is absent. So this is a characteristic feature of Burgess disease. Then if we now move further from males to females, there would be Reynolds disease. So Reynolds disease is more commonly seen in younger females. Okay, Reynolds disease is more commonly seen in younger females. Okay, so Reynolds disease is what? It is due to spasm of the arterioles whenever the extremities are exposed to excessively cold temperature, right? So please remember, whenever a female immerses her hand in some cold water, there would be spasm of the arterioles of the fingers, and that would lead to ischemia to the fingers. Okay, this is what is Reynolds disease, right? It is more commonly seen in young females. Okay, and in Reynolds disease, what will happen? As soon as the female immerses her hands in cold water, there would be a sequence of color changes, and this sequence of color changes, which are seen usually in the fingers, they are known as Reynolds phenomena. This sequence of color changes is known as Reynolds phenomena. Okay, so Reynolds phenomena is seen in Reynolds disease. And Reynolds phenomena, the sequence of color changes would be asked, and that is WBR. The mnemonic is WBR. So first, as soon as there would be exposure to cold, first of all, there would be spasm of arterioles leading to ischemia, therefore white color. Then, due to accumulation of deoxygenated blood, there would be cyanosis leading to blue color. And finally, restoration of blood supply would lead to red color. So white, blue, red. White, blue, red. Important. I hope this is fine with everybody. Moving further now. And usually in Reynolds disease, there is a conservative management. The female needs to avoid cold temperatures. Okay, important. Then moving further, if we talk about embolism now. Okay, embolism is a cause of sudden arterial obstruction. We saw gradual arterial obstruction. Now if we talk about sudden arterial obstruction, the most important cause is embolism. Okay, a thrombus gets dislodged from some artery and then gets lodged in some other artery, causing obstruction. This is known as embolism, right? I hope this is fine. So usually in embolism or sudden arterial obstruction, there are 5 P's which are important. Okay, these are the features which are seen. Okay, first is pain. Second is pallor. Third is pulselessness. Fourth is paresthesia, and fifth is poikilothermia, right? So first of all, whenever the blood supply would be impaired, there would be pain. Second, there would be pallor. Third, the pulse would be disappeared, that is pulselessness. Fourth, there would be some numbness or tingling sensation, that is paresthesia. And last, there would be cold extremities, this is known as poikilothermia. So these are the 5 P's, okay? Important. Then what should be done as a treatment for embolism or sudden arterial obstruction? So if a patient presents to us in emergency, our primary aim is to restore the blood supply, okay, and prevent the extension of thrombus. So to prevent the extension of thrombus, the first step, if asked, okay, if they ask the first step should be we should give a low molecular weight heparin. For preventing the extension of thrombus, the first step to be done is giving a low molecular weight heparin. But the treatment of choice in embolism would be thrombolysis. Treatment of choice would be thrombolysis. That is what we do in myocardial infarction also, right? Thrombolysis. And this thrombolysis is generally done with a tissue plasminogen activator. And which are the drugs which are tissue plasminogen activators? Those drugs are known as drugs like streptokinase, retiplase, altiplase, tinectiplase, all of these, okay? So these are thrombolytic agents. I hope this is fine. Emergency mein first step should be low molecular weight heparin. Treatment of choice should be thrombolysis with TPAs. Then if I talk about aneurysm now. What do we mean by aneurysm, guys? So please remember, aneurysm is nothing but an abnormal dilatation of a vessel wall. Right? Aneurysm is an abnormal dilatation of the vessel wall. Most commonly, this was a question which has been asked. Most common site of aneurysm would be abdominal aorta. So most common vessel affected with aneurysm is abdominal aorta. Most common vessel affected with aneurysm is abdominal aorta. Okay. And this is a question which has been repeated twice. So important. The most common peripheral artery, if they ask, they are not asking about aorta now. Okay. So if they ask most common peripheral artery affected with aneurysm, then your answer should be popliteal artery. Most common peripheral artery affected in aneurysm is popliteal artery. Most common vessel overall, abdominal aorta. Most common peripheral artery, popliteal artery. I hope this is fine. Then if I talk about a CT picture of thorax, okay, here is the CT picture of a thorax on which you can see a aortic aneurysm. And this aortic aneurysm, you can find that you can see a characteristic sign, and this is known as a meniscus or a crescent sign. Half moon shaped dikh raha hai na? So this is known as a meniscus or a crescent sign. This is known as a meniscus or a crescent sign. So meniscus or crescent sign is a feature of aneurysm. Meniscus or a crescent sign is a feature of aneurysm. What is the feature of aneurysm on CT? Meniscus or crescent sign. Then now if we talk about venous disorders, there was a bit of a confusion in the lecture that we had, so I am clearing it out over here. If we talk about venous disorders, guys, again the investigation of choice would be color, Doppler, and the best or gold standard investigation would be angiography, right? Then over here we will talk about ambulatory venous hypertension. What do we mean by ambulatory venous hypertension? I hope all of you are quite aware, in the lower limbs we have a deep venous system and a superficial venous system, right? So the superficial venous system usually has low pressure. It sends the blood to the deep venous system. But at times what happens usually, in between these two venous systems there are valves, okay? So one-way connection is only there. From superficial, the blood will only go to the deep venous system. But at times what happens usually, there is valvular incompetence. There is a valvular incompetence. That means the valves are not actually acting properly. Okay, and due to this valvular incompetence, what will happen? The blood from the deep venous system will now go to the superficial venous system, and therefore the pressure will increase in the superficial venous system. And whenever the pressure increases in the superficial venous system, these superficial veins are not actually used to having this much high pressure. Therefore, they get dilated abnormally. Okay, and this abnormal dilatation and tortuosity of these superficial veins are known as varicose veins. Okay, so this abnormal dilatation and tortuosity of these superficial veins is known as varicose veins. Okay, that is what is varicose veins. Abnormally dilated and tortuous veins, mainly seen in the lower limbs. Okay, and it is more common in females. So please remember, it is also more common in young adult females. It is usually more common in young adult females. I hope this is fine with everybody. So it is more common in a young adult female. Important, right? Ambulatory venous hypertension will mostly manifest in varicose veins. What would be the treatment? So if in early stages of varicose veins or ambulatory venous hypertension, we will try to manage the patient conservatively. What would be the conservative management? Either we will ask her to avoid standing for a longer period of time, first thing, so pressure would not rise. Second thing, we will ask her to elevate the limb elevation. Third thing, we will ask her to wear compression stockings. Important feature. Compression stockings पे पहले भी question आ चुका है, so it is important. Okay. So compression stockings are used in venous disorders of lower limbs. Okay. So compression stockings she can use definitely. Okay. Compression stockings can be given. Okay. So usually we have normal compression stockings, but in this condition there can be some electrically adjustable compression stockings also nowadays, and these are known as pneumostatic compression stockings. The image you can see over here, they can be adjusted, the pressure can be adjusted. These are known as pneumostatic compression stockings. Okay, air is filled inside to increase the pressure. I hope this is fine. So at least know the picture of compression stockings. Then in advanced stages or late stages of this disease, we can go on to other options like, first of all, we can do laser ablation of the vessel, first thing. Second, we can do a radio ablation of the vessel, or we can do a sclerotherapy. Injection sclerotherapy is done. We try to inject a sclerosing agent into this vessel. Okay. So usually in the great saphenous vein, we try to inject a sclerosing agent, and the most commonly used sclerosing agent is polydocanol. Most commonly used sclerosing agent is polydocanol, and it is used for injection sclerotherapy in cases of varicose veins. But the treatment of choice, guys, you need to know, it is the Trendelenburg operation. So treatment of choice for varicose veins is Trendelenburg operation. Treatment of choice for varicose veins is Trendelenburg operation, and I feel I have explained it in DVT. So please remember, it is the treatment of choice for varicose veins. And what do we do in Trendelenburg operation? So it is important to be remembered, guys. Here usually we try to flush ligate the great saphenous vein along with the femoral vein. Okay, we do flush ligation of the great saphenous vein along with the femoral vein. Sometimes we strip the great saphenous vein also. Okay, we strip the great saphenous vein, and then we can also operate the perforators. Okay, perforators are thus the connection between the deep and the superficial venous system. Okay, these are known as the perforators. So we can operate those also. That is known as perforator surgery. So all of this together is known as the Trendelenburg operation. At least remember, Trendelenburg operation is the treatment of choice for ambulatory venous hypertension or varicose veins. Trendelenburg operation is the treatment of choice for varicose veins. So what is the treatment of choice for varicose veins? Trendelenburg operation. Okay, and these patients of varicose veins usually present to you with aching discomfort. Okay, there would be calf pain or heel pain would be there commonly, right? Then so this is the picture of varicose veins, you all are aware. The second is a complication of varicose veins. Okay, and here what happens usually in the area of the medial malleolus or the gaiters area. Okay, the medial malleolus and lateral malleolus के बीच का area, it is known as the gaiters area. So in the over the medial malleolus or the gaiters area, the person or the female will develop most likely a brownish discoloration. Okay, it is due to skin ulceration वगैरह, and this is known as lipodermatosclerosis. So lipodermatosclerosis is a complication of varicose veins. What is the complication of varicose veins? Lipodermatosclerosis. Then talking further about DVT now. Okay, deep venous thrombosis. So by the name itself you can remember deep veins में thrombus बन रहा है, right? So there is thrombus formation in the deep veins of lower limbs commonly. So that is known as deep venous thrombosis. Most common cause of deep venous thrombosis, if they ask congenital cause, it is Leydens mutation. Most common congenital cause of DVT is Leydens mutation. Most common congenital cause of DVT is Leydens mutation, which is a factor 5 mutation. Okay, therefore the clotting factor 5 will not be properly formed. That would lead to coagulopathy. Then next one is the acquired cause. Most common acquired cause of DVT would be Aplar syndrome. Most common acquired cause of DVT is Aplar syndrome, that is antiphospholipid antibody syndrome. Antiphospholipid antibody syndrome. Yes, DVT is also seen due to prolonged immobilization. So for example, if a patient is suffering from paraplegia, or if the patient is more likely suffering like he has undergone a major surgery and he has been given bed rest for almost 3 to 4 months, then also there is a high propensity or high risk that there would be thrombus formation in the deep veins. Okay, so prolonged immobilization is also a risk factor for deep venous thrombosis. Important question from orthopedics also. Then if we talk about the most common cause of death, so please remember the most common cause of death in cases of DVT would be pulmonary embolism. Now the thrombus from the deep veins will get dislodged, go into the pulmonary circulation and will cause respiratory distress. So a patient of prolonged immobilization complaining of respiratory distress, he is likely to be suffering from pulmonary embolism. So most common cause of death in DVT is pulmonary embolism. Then if we talk about two important signs, and these are important because questions have been asked, okay. So if you are examining a patient of DVT, what will you, first of all, you will try to press the calf. Whenever you press the calf, there would be pain, okay, and this is known as the Moses sign. So pain on pressing the calf is known as the Moses sign. Pain on pressing the calf is known as the Moses sign, right? Important. Second, whenever you try to dorsiflex the foot, okay, this is her foot, this is her leg. So whenever you try to dorsiflex the foot, there would be pain in the calf. Whenever you try to dorsiflex the foot, there would be pain in the calf, and this is known as the Homan's sign. Okay, pain on dorsiflexion is known as Homan's sign. Pain on foot dorsiflexion is known as Homan's sign. So Moses sign and Homan's sign are two important signs seen in deep venous thrombosis. Then if you talk about the treatment of deep venous thrombosis, usually it is a conservative management. Okay, here it is a conservative management, and it is usually managed with some anticoagulants, and the most preferred one would be heparin. Okay, a low molecular weight heparin can be given for these patients to prevent the extension of the thrombus. Okay, so important one is this, okay, that you need to remember. The treatment of choice for DVT patients is usually conservative. Okay, the treatment of choice for DVT patients is usually conservative. In some cases, if the patient presents to us with embolism, then thrombolysis would be indicated. Then if we talk about the next one, the images that you have down here, so these images had come earlier. If you can see a lot of multiple ulcers, okay, a combination of ulcers over here at the area of medial malleolus commonly, it is commonly due to a venous ulcer. It is usually a venous ulcer. So if you can see multiple ulcers, it is due to a venous ulcer. Multiple superficial ulcer are venous ulcers. But a deep single ulcer would be a arterial ulcer. A deep single ulcer would be a arterial ulcer. Then the third image shows you a neuropathic ulcer. Neuropathic ulcer can usually develop if there is some injury to the foot. In patients of diabetic neuropathy, okay, they can be at a risk of developing this neuropathic ulcer, which can further progress if the infection spreads. It can further progress to diabetic foot. I hope this is fine. And the last one that we have, guys, is your pressure source. Pressure source you can say, or pressure ulcers. Okay, so please remember, pressure source or pressure ulcers के लिए most common site we discussed, it was the sacrum. Most common site for pressure source or bed source was the sacrum, but the second most common site is your heel. Okay, and it can present as this also. I hope with this I have completed the vascular surgery. Tomorrow, in tomorrow's session, we'll be covering thyroid and breast. I would request you all to watch this session once. Okay, so tomorrow we'll covering thyroid. We will be covering thyroid, breast, and the initial parts of GIT. Okay, timing would be informed in the group. Thank you so much, and let's meet. Okay, till the time, goodbye, good luck, and good night. Take care.